The World Health Organization recommends against the usage of sugar substitutes for weight loss purposes. New guidelines from the World Health Organization advise against the use of sugar substitutes if weight loss is the goal. According to a systematic review of existing evidence, the use of non-sugar sweeteners, NSS, does not provide any long-term benefits in terms of reducing body fat in adults or children, as reported by the Global Health Organization. According to the review, the prolonged usage of sugar substitutes might lead to potential unwanted consequences, including an elevated risk of type 2 diabetes and cardiovascular diseases. According to Francesco Branca, the Director for Nutrition and Food Safety at WHO, substituting non-sugar sweeteners, NSS, for free sugars does not contribute to effective weight management in the long term. Rather, individuals should explore other means of limiting their intake of free sugars, such as consuming foods that contain naturally occurring sugars, such as fruits, or opting for unsweetened foods and beverages. This statement was made in a press release. Branca suggests that NSS, or non-nutritive sweeteners, are not necessary for a healthy diet and do not contribute to one's overall nutrition. Rather, individuals should aim to decrease the amount of sugar in their diets from an early age in order to promote better health. With the exception of those who have pre-existing diabetes, the organization has advised that its recommendation applies to all individuals. According to Ian Johnson, a nutrition researcher and emeritus fellow at Quadram Institute Bioscience, formerly known as the Institute of Food Research in Norwich, United Kingdom, the new guideline is grounded on a comprehensive evaluation of the most recent scientific literature and highlights that utilizing artificial sweeteners is not an effective approach to reducing dietary energy intake for weight loss. Although Johnson stated that sugar intake may not be a direct indicator of weight control, he also emphasized that it should not be disregarded completely. Johnson suggested reducing the consumption of sugar-sweetened drinks and opting for raw or minimally processed fruits to satisfy one's sweet cravings. According to Dr. Keith Ayub, a scientific advisor for the Calorie Control Council, an international association that represents the low-calorie food and beverage industry, the World Health Organization's emphasis on preventing unhealthy weight gain and non-communicable diseases is misguided, as he stated in an email to CNN. According to the president of the Calorie Control Council, Robert Rankin, the use of low and no-calorie sweeteners can be a crucial aid for consumers in managing their body weight and mitigating the risk of non-communicable diseases. The review encompassed 283 studies in total. These studies were comprised of both randomized controlled trials, which are widely regarded as the pinnacle of research, and observational studies. It should be noted that while observational studies can establish an association between variables, they do not serve as conclusive proof of direct cause and effect. According to a news release from the WHO, policy decisions made based on this recommendation may necessitate extensive discussions in individual country contexts, which could be influenced by factors such as the level of consumption among various age groups. According to the report, randomized trials showed that non-sugar sweeteners had a relatively low impact on reducing body weight and calorie intake compared to sugar, and that there was no noticeable change in intermediate markers of diabetes, such as glucose and insulin. The studies that relied on observation have determined that there is a minimal effect on both body weight and fat tissue, but no noticeable alteration in calorie consumption. Nevertheless, these studies also found that there is a low susceptibility to type 2 diabetes, high blood pressure, stroke, heart disease, and mortality from heart disease. The report also observed that the risk of bladder cancer and premature death, regardless of the cause, is very slight. According to WHO, the recommendation was labeled conditional due to the possibility of confounding factors such as complex usage patterns of sweeteners and the characteristics of the study subjects, which may affect the identified link between sweeteners and disease outcomes. The International Sweeteners Association, an industry association, stated in an email that they are disappointed by the World Health Organization's failure to acknowledge the public health advantages of low, no-calorie sweeteners, and that the organization's conclusions were primarily derived from observational studies with low certainty evidence, which are at a high risk of reverse causality. Within the recommendation, the World Health Organization, WHO, listed various options for low or no-calorie sweeteners, both synthetic and natural extracts, some of which may undergo chemical modification, including acesulfame K, aspartame, advantame, cyclamates, neotame, saccharin, sucralose, stevia, and derivatives of stevia. Stevia products are often regarded as more natural by many individuals as they are sourced from the stevia plant. In contrast, other natural and artificial sweeteners utilize additional sugars to dilute their sweetness and increase the product's volume, which is useful for baking purposes. According to a study conducted by researchers at the Cleveland Clinic in the US, erythritol, which is commonly used for adding bulk or sweetness to keto-reduced sugar products as well as stevia and monk fruit, has been associated with an increased risk of blood clotting, stroke, heart attack, and premature death. The study revealed that those who had high levels of erythritol in their blood and pre-existing risk factors for heart disease such as diabetes were twice as likely to suffer from a heart attack or stroke. Pre-packaged foods and beverages often contain non-sugar sweeteners as an ingredient, and consumers may also directly add them to their food and drinks. In 2015, WHO released guidelines regarding the consumption of sugar. These guidelines suggested that both adults and children should reduce their daily consumption of free sugars to under 10% of their total energy intake. This recommendation has sparked a growing interest in sugar substitutes, according to the review. According to Lisa Dreher, a licensed dietitian who wrote an article for CNN, even if you consider yourself to be a genuine sugar addict, there is still hope for you to reduce your sugar consumption. Dreher suggests following these steps. Dreher suggests that one way to reduce sugar cravings is by training your taste buds. By gradually decreasing the amount of sugar in your diet, including artificial sweeteners, and increasing your consumption of protein and fiber-rich foods, you may be able to lessen your desire for sugar. In a previous interview, she stated that the consumption of protein and fiber in conjunction with sugary foods can slow down the sudden increase in blood sugar levels. Additionally, this can increase satiety and potentially lead to a reduction in sugar intake. Opt for foods that have no added sugar and steer clear of beverages that are sweetened with sugar. For instance, consider selecting whole grain cereal or Greek yogurt that is devoid of sweeteners. Remove all sugar-sweetened drinks such as energy drinks, sodas, sports drinks, and fruit punch from your shopping list. Instead, select water as your preferred beverage. Dreher recommends adding a small amount of cranberry or orange juice to a carbonated beverage if you enjoy drinks with a sweet taste. Another option is to try flavored seltzers. For those who prefer a natural and less processed option, flavoring water with fruit slices can be a great alternative. Alternatively, herbal fruit teas can also be used to add flavor to plain water. To reduce sugar intake, it is advisable to drink coffee and tea without sugar or with a minimal amount. It is important to be cautious while ordering beverages at coffee shops, as Dreher warns that many specialty drinks such as lattes and flavored coffees can contain as much or even more sugar than a typical soda can. For a healthier alternative to traditional desserts, consider indulging in fruit. Rather than reaching for cookies, ice cream, cake, or pastries, opt for grilled peaches, berries, or cinnamon-baked apples instead. According to Dreher, this simple substitution can have a significant impact on your health and well-being. Be wary of hidden sugars. It is common for added sugars to be present in food items that are not traditionally considered sweet, such as dressings, condiments, sauces, and breads. Dreher advises this cautionary approach. According to Christy King, a senior pediatric dietitian at Texas Children's Hospital and a national spokesperson for the Academy of Nutrition and Dietetics, pre-packaged sauces such as ketchup, BBQ sauce, and tomato sauce are among the primary culprits of concealed added sugars in one's diet, as she previously stated in an interview with Dreher. When it comes to maintaining a healthy diet, it is important to be mindful of the nutritional value of the food and drinks we consume. One way to do this is by checking the nutrition facts labels provided on all products. These labels are required to list the exact type and quantity of sugar contained within each item. Dreher explained that various names are used for added sugars, including but not limited to agave, brown sugar, corn sweetener, corn syrup, dextrose, evaporated cane juice, fructose, fruit juice concentrate, fruit nectar, glucose, high fructose corn syrup, honey, invert sugar, lactose, malt syrup, maltose, molasses, maple syrups, raw sugar, sucrose, trehalose, and turbinado sugar. According to her, the quantity of added sugar in a product is directly proportional to the position of added sugars in the ingredients list, implying that the higher up they are, the more prevalent they are. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.